Hi, for my top 10 list, I did the topic of acupuncture. My name's Grant Thompson. Here's my top 10 list for acupuncture. Some of the notes about my top 10 list are that there are over 600 acupuncture points on the body. These points range from the toe to the head all over. They're connected through the meridian system. This system is a concept in traditional Chinese medicine, and it focuses on life energy and flows. Every point in the body has its own function, and many of them work on both a physical and mental emotional level. Another point is that traditional Chinese acupuncture and Western practice of acupuncture vary. In traditional Chinese acupuncture, it's explained as a technique for balancing the flow of energy or life force. This is believed to rebalance your energy flow when the needles are inserted in specific points along the meridians. And in Western hemisphere of the practice, it's more focused on stimulating nerves, muscle, and connective tissue, and it can be used for many different treatments across the body. Acupuncture is very individualized depending on the patient. For example, like 12 to 15 different patients could come into the same clinic, all suffering from headaches. And if all these patients decide to do acupuncture, every single one of them could have different points chosen for their acupuncture treatment. There are certain trainings and credentials for those that practice acupuncture. It's mainly regulated at state level. For example, the requirements in Ohio involve being 18, passing a criminal background check, and holding a current and active designation from the National Certification Commission for Acupuncture and Oriental Medicine. There's also a lot of states that require at least 2,000 clinical hours, and there are doctorate and graduate programs around 3 to 4 years. Lastly, acupuncture has very few side effects. Due to the needles being very small and short, about the thickness of 2 human hairs, there are few side effects at all. These side effects, though, include minor soreness, bruising, and bleeding where the needles are inserted. There is also a slight risk for infection, but that is close to none now because single-use disposable needles are the new standard.